Hello everyone, my name is Motaz Daraghma, and today I will be presenting a blog summary titled High Pitch, Low Risk, the Future of Pediatric Lung Imaging with Photon-Counting CT. This presentation covers a recent Phantom study exploring how photon-counting CT can safely reduce the radiation dose in pediatric lung imaging while maintaining diagnostic image quality. So we're going to start our presentation by asking you a question. Why pediatric lung imaging needs innovation? Actually, there are many challenges. First, children are more sensitive to radiation than adults, which means long-term cancer risks are a serious concern. Second, traditional CT protocols often involve higher doses than what is ideal for small developing bodies. Third, because children struggle with the breath holding, scans often require sedation to reduce motion artifacts. These issues demand a balance between diagnostic accuracy and patient safety. This is where photon-counting detector CT comes in, as it offers a promising path forward by delivering faster scans, lower doses, and sharper images. This study was recently published in Pediatric Radiology journal. It tested how low we can push the radiation dose without compromising image quality. The researchers of this study used a chest phantom mimicking a 5-year-old child and imaged it using the Nuatum Alpha, which is a dual-source photon-counting CT scanner from Siemens. Two scan modes were tested, standard and ultra-high resolution. They ran scans at 5 different dose levels, from 0.45 milligray all the way down to just 0.01 milligray. They also applied different levels of quantum iterative reconstruction, which is a post-processing technique designed to reduce noise. Finally, both subjective image quality and objective noise measurements were assessed. Now we move to the results for this study. Scans performed at just 0.07 milligray combined with quantum iterative reconstruction level of 4, maintaining adequate image quality even for tiny peripheral lung structures. This is more than 20 times lower than the US reference dose for pediatric chest CT. Additionally, the ultra-high dose resolution mode consistently delivered better signal-to-noise ratios and lower image noise across all dose levels. Even with high resolution, scan times remained under 1 second, which potentially reducing or eliminating the need for sedation. Importantly, applying quantum iterative reconstruction made a major difference, as it cuts image noise up to 73% and boosts signal-to-noise ratio by over 280%. To conclude, this study shows that photon-counting CT can safely advance pediatric lung imaging to the next level, where ultra-low dose scans are not only achievable but clinically practical. With high-pitch acquisition, quantum iterative reconstruction, and ultra-high resolution, radiologists can now scan children with much greater safety without compromising diagnostic accuracy. This approach may be particularly beneficial for children with chronic or recurrent lung diseases or in situations where avoiding sedation is a priority. While further studies in real pediatric patients are needed to validate these findings, the initial data is highly encouraging. Overall, photon-counting CT represents a major step forward, combining precision with protection in pediatric imaging. Thank you for listening.